All right. A lot of times when our patients are preparing for a fat transfer procedure, they like to ask, should I gain more fat so I have more fat to give? As tempting as it might sound to go on a chocolate cake diet, that's not the best strategy to go forward because, first of all, when we're doing a fat transfer procedure, we want to see your shape as you are at baseline so we can ultimately enhance it while we're changing it. Okay. Second thing is the second you undergo surgery and go back to your normal healthy lifestyle, exercise, and typical diet, your weight is going to stabilize again and you're going to lose weight. Now, fat cells respond as they would any other part of your body, right? They are living cells. So if you gain a bunch of weight, they will all expand. If you lose a bunch of weight, they will all shrink. So you don't want to disturb that balance of fat cells in your body for the sake of artificially enhancing how much fat you have to give right before surgery, because we want your results to be as stable as possible afterwards too.
Probably the biggest ICLS advantage that we have with fat transfer is we've been doing it forever. We've been doing it since the late 90s, and it is definitely a learned skill, and that makes a big difference for fat take. We've gone through generations of all different preparation modules and methods and spinning and not spinning. So you're hearing a lot of stuff. And we've had the advantage here at ICLS to have training with the world's greatest. Dr. Roger Corey, Dr. Dan Del Vecchio, Dr. Simeon Hall, Dr. I'm forgetting people, forgive me, Lou Bucky, and really taking all of that information and coming up with a method that it makes sense for ICLS and for our patients. The other thing that's a huge ICLS advantage is technology and how we harvest fat. We use the Vaser ultrasound-based technology, which shakes the fat loose in a very gentle, controlled way. The other advantage of the Vaser liposuction technology to shaking the fat loose, you've heard before from us, is it tightens skin. So you're taking it from somewhere and you're getting skin tightening. So, but it also makes a good quality of fat when we're injecting it. Also, we have so many modalities for injecting fat. When it's in the face, we have very, very, very fine cannulas. In sort of intermediate areas, we have medium-sized cannulas. We also have what we call EVLT, expansion vibration lipofilling. So that's for larger volumes like the buttock and the breast. So we have all of it here at ICLS. So we pick and choose the right method for taking the fat, preparing the fat, and injecting the fat to make it right for each individual and for each individual area that we're treating, because it is different per area. It's also probably my favorite operation. Let's be real. Take fat from where you don't want it and put it where you do want it. So it's kind of a fun operation to do.
A lot of times when we're doing a fat transfer procedure, our patients ask, the fat that's transferred, is that temporary or are the results permanent? Well, one of the analogies we really like to talk about when we're talking about fat transfer procedures is to compare it to growing grass. Same way that when you're growing grass, you want to make sure you prepare the soil, plant the seeds in optimal conditions. But even under the best of circumstances, we know that not every single one of those seeds sprouts. Same thing applies to fat. We prepare your body for the fat transfer procedure. We implant the fat cells in the ideal way to maximize their survival of these cells. But similar to the grass growing, we know not every single fat cell ultimately survives. Depending on the technique and what we use, we typically say that you may expect to lose 30 to 40% of the fat cells that are transferred. But what you have at 6 months is yours to keep. So final results typically seen at 6 to 12 months. And as long as you remain weight stable, you can expect to keep the same results lifelong.